my name is Whitney, and I'll be your nurse today. It's
Hi.
nice to meet you.
Hi, Whitney. It's nice to meet you.
I need to ask you some questions just so that we can figure out why you're here today and just so we can know a little bit more about you. The interview should only take about 5 to 10 minutes, and everything will remain confidential just between me and the staff. And do you need to use any, the restroom, or do you need any medications? Are you comfortable before
I'm fine,
we start?
thank you.
Okay. Okay, so can I get your name?
My name is Mary Smith.
Okay, and your age?
45.
Okay, and your address?
It's 21 West Briarley Street, Winchester.
Okay, and your marital status?
Married.
Okay, and your occupation?
Account manager.
Okay, and so if you're an account manager, what's the reason for you to have to seek care today?
I'm here today because I have lower back pain. I've had for a very long time, and I just want to see if anything can be done to help relieve it.
Okay, how long would you say that you've had this problem?
For many years, I had a back injury when I was 31.
Okay.
And I did seek medical profession then, orthopedic. Took x-rays, put me on steroids, wanted to do surgery. And at that point in my life, I had just had a small child. So I did not want to have surgery on my back. So then I went to a chiropractor and done therapy with him.
Okay, so you didn't do surgery?
No, I did not do surgery. But I had a lot of sciatic pain.
Okay.
The doctor told me that my lower disc was bad and just needed really to come out.
Okay.
And I had sciatic pain in the left leg all the way down the leg.
Okay, that must have been hard to deal with.
Yeah, it was very painful.
Okay. So can I ask what makes it better, your pain?
I don't have the sciatic pain now. Every once in a while I get a little twinge of pain in my left hip. Like I said, I went to a chiropractor, done therapy with him for about 1.5 years.
Okay.
So my pain as far as the sciatic, that subsided. But now I'm just left with pain in my back, in the middle part of my back where that disc is.
Okay.
And of course, as I get older, I notice going into premenopause that there's a lot of inflammation in my back now, and I'm assuming that it's probably around that old injury.
Okay. Can I ask you what makes your pain better? Worse?
Well, you had asked me, I didn't really answer the question, did I? I guess what makes it better is, of course, exercise, and ibuprofen helps. Heat, cold, if I use a heating pad and ice on and off.
Okay, now you say exercise. Can I ask what you do for your exercise, for your daily activities?
Just stretches,
Okay.
mostly stretches that the chiropractor told me to do.
Okay.
And then you ask what makes it worse. Sometimes just daily activity, cleaning the house, sometimes the way I sit in my chair, my posture if it's bad. Sometimes the way I lay in bed, sometimes the way I sit in a chair, going up and down the steps, that kind of thing.
Okay. Okay, so now the pain that you're telling me about, is it more of a constant pain, or is it more where it comes and goes? Or?
I would say it's probably more of just a kind of a dull, constant pain.
Dull, constant
Every
pain?
once in a while I get a break throughout the day where my back won't hurt. And then I notice that when I do physical activity, go get groceries, mow the yard, or something like that, it'll make my pain worse.
Okay, so now how would you say that you're feeling right now?
Right now I'm comfortable.
You're comfortable?
Yeah.
Okay, so can you describe to me what exactly this pain feels like that you're having?
I would say it's just like a dull, aching pain, like a toothache.
Okay. And
it's just nagging. You know it's always there. It just really never goes away.
Okay. Would you say that this pain is more of a moderate, a mild, or severe pain that you're having?
I would say it's probably moderate. There are times when it is a mild pain, and there's some times when it's a severe pain, and I'm just really in pain. But take a couple ibuprofen. It seems like within an hour, half hour, something like that, I'll notice it'll ease up.
Okay.
Or like if I change my posture has a lot to do with it. If I change the chair that I'm sitting in or something. That helps. Something with some support.
Okay. So now on a scale 1 to 10, 10 being the worst and 1 being the least, how would you say that your pain probably is right now?
Right now, at this moment, it's probably a 4.
Okay, and how would you say it normally is around?
On, I would say probably bad days, it could be a 7 or an 8. I mean,
okay.
Sometimes it keeps you from doing things that you enjoy doing because your back just hurts you all the time.
Okay. So now, is there an area of your body that it affects? I know you had mentioned your sciatic nerve.
That comes and goes. That's not a constant pain there.
Okay.
I'm bothered with this hip occasionally, but not very often. Once the chiropractor usually puts me back in line. But it's gotten to the point now where it's affecting both hips. And I guess that's the inflammation from the injury, because I get really stiff in the hips now. And
when you say stiff in the hips, can you be more specific?
When I get up out of bed, or if I've laid on the couch or anything, it's hard to move around for a little bit until I put some ice on it to get the inflammation down.
Okay. So now, does these symptoms, do they radiate anywhere? Is it just in your sciatic nerve and in your hips, or is there?
It affects my knee,
Okay.
because I guess I walk with a limp, is what I've been told by the chiropractor, because I have one leg shorter than the other, which most people, he tells me, does.
Okay.
But once he adjusts me, puts me back in line, that helps the knee.
Mm-hmm.
But then after about a month, I can tell that, I'm walking funny again, because it's mainly on this side of my back. So I put pressure onto this side of my leg, which affects that knee.
Okay.
If that makes any sense.
Yes, it does. So then it's just in your lower back.
It's in my lower back, yes.
In your hips,
Mm-hmm.
and in your right knee.
Yes.
Okay, in your sciatic nerve. Okay. So, you said you were taking medicine. Are you taking any prescribed medicines?
Not prescribed from the doctor, no. I did find at the vitamin store there's a natural herbal supplement that does help the inflammation.
Okay.
If I'm in a lot of pain, I will take one of those, and that does help relieve it along with ibuprofen.
Okay. So now, can I ask you, you said you've had this for years now. Mm-hmm. What makes you come in today?
Well, basically because I've noticed I've had a lot of acupuncture done from the chiropractor.
Okay.
Which does help, but then of course it's like anything else he does, the pain comes back. I just want to see if there's anything else besides surgery that will help the pain. Is there a steroid shot? I want to see how bad, I guess, that the injury has gotten over the years.
Okay.
So, I mean, I'm not getting any younger. None of us are, so.
No, none of us are.
So, I just want to see if there's something out there besides surgery. Would surgery really help me at this point? Or,
okay.
Okay.
Okay, and now, have you had any accidents? I know you said you haven't had surgery.
No, I mean, I had the back injury when I was 31, and I think that came from just lifting a lot of heavy furniture. Trying to lift things that I shouldn't have been lifting. Went through a divorce, moved a lot.
That had to be tough.
Yeah, and just having my daughter. I mean, when you have an epidural, that I think that kind of weakens a woman's back too, and I think that had something, just a combination probably of everything.
Okay.
Just basically kind of abusing your body over the years, because you just lift things that you shouldn't be lifting, and you don't lift them properly, and your back gets tight, and you end up hurting something in there.
Okay.
So.
Well, that has to be tough going through a divorce and everything.
It was at that point, yes, in my life it was.
Yeah, I'm sure.
Mm-hmm. But I've remarried since. It's fine now.
Good, good. As long as you're happy.
Yes.
Good. Mm-hmm. Okay, so I think I have all the information that I need. So we're going to get started and try to figure out what we can do for you to help you.
Okay.
And is there anything else that you would like to discuss that we haven't touched on, or any questions that you have for me?
No, I think, we basically discussed everything,
Okay.
So.
Okay, well then I will see what we can do for you, and I'll be back
Okay.
in about 20 minutes to check on you and see how
Okay.
you're doing.
All right,
Okay?
thank you very much.
All right, it was nice to meet you.
Nice to meet you too.
All right.
All right, bye-bye.